Hi, Gwen here, doing the discussion board review for this week. We did chapters 18, chapter 16, and chapter 8. Just a little highlight. Chapter 18 were the factors that affect aerobic capacity in our older adults and the results that occur from cardiovascular and pulmonary disease and the role of the physical therapist there. Chapter 16 was consequences associated with sarcopenia and the way that PTs can help. And Chapter 8 discussed the role of physical activity and exercise and sedentary life and how we can engage the older population. I chose this template because it looked like it'd be a great place for us to be reading our post-professional geriatrics and physical therapy readings this summer. The discussion questions were one based on chapter 18, wanting and needing physical therapists to be creative. Secondly, about use of NSAIDs and the treatment of and concerns with blood pressure treatment, and what other supplements or medications you have came upon that are a problem. And the third question was any idea for older populations and wearable devices specifically for monitoring aerobic capacity. So in response to creative ideas, we noted that special needs and meaningful activities can be modified, or we can modify higher level function activities that can be reproduced by our older population. Better adherence to the program and more joy are prevalent with a variety of exercises. Individual exercises are correlate with high compliance, and functional testing can help determine where the individual needs to be to improve their aerobic capacity. Some interesting things on supplements and monitoring, including perceived exertion could be a monitoring device, especially with those with beta blockers, and an interesting one for Michael about supplements and using beetroot juice to lower blood pressure. With wearable devices, it was primarily noted that the younger population is more apt to wear them at this time, but wearable devices are shown to show increased physical activity even in the elderly, but they especially like the social collaboration of using these devices. And then the last slide here is just the references that had been put out on the discussion board for anyone who's looking for those. Thanks for participating and look forward to our further discussion throughout this summer.